I mean, he was only beginning stage dementia. He would just forget things from the current things. He didn't forget the past things. I mean, he could go on and on about our life together and all kinds of things from the past.
I just want to say for the record, number one, that we have never been sued by anyone. We have glowing recommendations from not just present residences, but even past residences that were there. We never had any issues whatsoever.
Guess what? I can guarantee that other people are going to die in that facility. Okay, we're here for case number 8305, Kathy Knight versus Edward Gore. Miss Knight, if you can come forward to the podium. Mr. Gore, if you can come forward to the podium. Hello, Miss Knight, am I reading this right, or is this a typo? You're suing Mr. Gore for $5 million?
That's correct.
It's not a typo. $5 million.
$5 million.
Whoa. Oh, man, this is going to be good. What happened?
Well, my husband was at Maple Grove Nursing Facility.
Okay.
And I have gone often to make sure everything is going correctly there. And
when you say you're there to make sure that everything is going correctly, what do you mean by that exactly?
Well, my husband was 91 years old.
You said was. Is your husband's deceased?
That's right.
Well, I am sorry to hear that, ma'am. And did he pass away at this particular facility?
That's correct.
Okay, so what happened, ma'am?
Well, apparently, whenever the call button was rung, the attendants didn't come right away.
The call button, you mean the button that your husband would push in his room for assistance?
Yes.
Okay, and how do you know that the call button wasn't activated properly?
Well, I've seen it happen before. So I'm not quite sure.
You mean you were there when your husband pushed the call button, or maybe you pushed the call button and
people don't come right away. Correct.
All right.
So these things have happened before. That's why I go often to make sure that he would be okay. He is 91.
Now I've been in a few hospital rooms. I've been in a few hospital rooms myself, and I've seen where you push the button or whatever. So I guess my question to you is, when you say right away, what time frame are we talking about?
Well, when you're dealing with somebody who's 91 years old, has limited mobility, has comorbidities, you better come right away.
Okay, but again, when you say right away, are you saying immediately, like right now?
Mm-hmm.
Okay.
Yeah,
please
like
continue.
Right now, because when you're that age, every minute counts. Anything could happen.
Okay, continue.
Well, apparently, my husband fell and suffered, like his heart gave out.
How did he fall?
I'm not sure. I wasn't there.
Okay. So the staff told you that your husband fell?
Yes.
Okay.
And I don't know. Maybe he tried to get out of bed. I'm not really sure. He did have beginning stage dementia. So it is possible that he tried to get out of bed without help, and maybe he fell, and that caused the heart to give out. I'm not sure.
I'm looking at a form that you filed with the courts, and if I may read the conditions, is it okay? It says here that your husband suffered from advanced heart failure, type 2 diabetes, and early stage dementia. That correct? And his mobility was limited. This is what you filed with the court. This is what you gave.
That's correct.
Okay. And you say he was 91 years old? All right, please continue.
Well, I think that Richard had a good 5 years left in him.
Richard, that being your husband.
That's correct.
Okay.
I mean, you know, he was only beginning stage dementia. You know, he would just forget things from the current things. He didn't forget the past things. I mean, he could go on and on about our life together and all kinds of things from the past.
Let me ask you this question. How long were you guys married?
We were married 20 years.
20 years? Okay. Hold that thought. Sir.
Yes, thank you, Judge Porter.
Mr. Gore, what is your position with the Maple Grove Nursing Home?
Well, I happen to be the owner of Maple Grove's nursing homes. Obviously, number one, my condolences to your husband. I don't believe that we are responsible because her husband, number one, Mr. Knight, I believe, suffered from all kinds of health issues.
That he did.
Yes. Number one, I believe he suffered from stage 4 congestive heart failure.
That he did. That he had.
He was a type 2 diabetic. He had severe arterial blockage in his heart. And honestly, the prognosis was not looking good for him. I believe his time on earth was limited. Based on that, I don't believe he had 5 years left.
Okay.
He's not God. How does he know how long my husband had?
Judge
well,
Porter,
to be
according
fair,
to the doctors.
Give me 1 second.
Yes,
to be fair, ma'am, you did say that you believe he had 5 years. So I guess the question could be asked, how did you know? You're not God. How would you know that he had 5 years?
Yeah.
Because I lived with him for 20 years.
Okay.
I knew his constitution. I knew that he had in him.
All right, this is an uncomfortable question, but I have to ask so I can get some clarity on this. What was his cause of death? Either one of you can answer that question.
I personally believe that.
What did, I don't know if it was the EMT that showed up. I don't know if what the death certificate has already been done. How long ago did this passing happen?
It's really only been a month.
It's only been a month?
Yeah.
Okay. Was there a medical examiner involved or did a doctor sign his death certificate?
The doctor signed it.
The doctor signed? Okay. The doctor signed. What did the doctor say was the cause of death?
It's a heart attack.
A heart attack?
Yeah.
Okay. Ms. Knight, why are you suing Maple Grove Nursing Home?
Maple Grove Nursing Home, yeah.
For negligence, that's why.
Where's the negligence?
Well, if they had answered the buzzer and had somebody there to do CPR quicker, maybe my husband would have survived.
Okay, did he suffer a cardiac event at your facility prior to his passing?
I believe he did, and because of that...
Well, you know what? I asked the wrong question. Did he die at your facility?
He died at the facility.
Okay, did he suffer a cardiac event at your facility?
Yes, he did.
Okay.
And I want to also say, Judge Porter, that all protocol was followed.
Can you explain the protocol, please?
Yes. Number one, aside from everything being documented, the 911 calls, you can check the logs.
All right. So a 911 call was made when
Yes.
he went into cardiac arrest?
Yes.
Was an EMT sent to the location?
Yes, indeed.
Do you know what actions they performed?
They performed CPR.
Mm-hmm.
They did everything possible to try to save Mr. Knight.
Okay. Now, did they transport him or was he pronounced deceased at the scene?
I believe he was transported via ambulance.
Okay, so does that sound correct to you, ma'am? He was transported to a hospital? So your husband passed away at the hospital?
By the time he got to the hospital, he was already dead.
Okay, so in transport, your husband passed away.
Yeah, I guess they tried to do CPR in the ambulance or whatever.
Well, no. Actually, they performed CPR at the facility, and then they continued to try to resuscitate Mr. Knight while he was in the ambulance.
So during the transport,
Yes.
CPR was still being conducted, and at some point in time, they called it in transport.
That is correct, Judge Porter.
Okay, Ms. Knight, I'm not understanding why you're suing Mango Grove. I'm lost. Help me understand that.
All of the emotional suffering that I have gone through. $10,000 a month I paid to have my husband there.
How long was he at this facility?
He was there for a couple of years.
How many?
And
How many years, ma'am?
2 years.
2 years?
And, you know, I would go sometimes. That's why I know about the call button. I would go sometimes and he wouldn't even be dressed.
Okay.
And why? Because he had limited mobility and they had to get him dressed. Or sometimes he wouldn't be shaven or properly bathed. And I would come in and question all of this. You have to watch every little move they make at these nursing homes.
And I agree.
And I did go often and I did take care of him.
But if you felt that the facility was subpar, why did you leave him there?
I kept giving them chances.
For 2 years?
$10,000 a month. I can't believe
But for
it.
2 years?
Well, there isn't much other option that's near me.
Hold that thought. Yes, sir.
Judge Porter, I just want to say for the record, number one, that we have never been sued by anyone. We have glowing recommendations from not just present residences, but even past residences that were there. We never had any issues whatsoever.
Miss Knight. Miss Knight, let me ask you this question. How are you doing right now? Like right now at this minute, how are you feeling?
I'm not doing very well.
Okay. I understand that Richard is gone. And that's got to be a hurtful and painful experience. But what I believe is going on right now is that it's not a matter that Richard received poor care. That doesn't seem to be the issue here. The issue is that you're looking for someone to blame the grief that you're going through right now. And here's the thing. They're not at fault for what happened to Richard. Okay? I need you to understand that. When you said that they should have, when you pushed the call button and someone should respond immediately, I'm going to be honest with you. That's not a reality because Richard is not the only patient at the facility. Am I correct in saying that?
That is correct, yes.
There are other patients and the staff is only so many people.
Yeah, but when you have a 91-year-old patient
but
and
if this
he
is
has
a
limited
nurse,
mobility,
but ma'am, if this is a nursing home, I can almost assure you that they have other 90-year-olds who have their own medical issues.
Yes.
Your husband was not exclusive to that. I need you to understand that. I am sorry that your husband is gone. And I feel your pain. I don't know what it's like to lose a spouse. Okay, someone that I've been with for X amount of years and all of a sudden they're gone.
I tried to tell them that, you know, he was starting to get up out of bed, you know, and not be able to really walk properly, that they better be careful because he could fall.
Ma'am, I understand that. But they can't have nobody in the room with him 24/7 to make sure he doesn't get up and fall. That's not a reality. That's not a reality. Even if you were in the room and you decided that you wanted to use the restroom and you walked off and he got up at that point in time and fell, could somebody say that you were at fault for that? Absolutely not.
No. That's why I had him in there, because I couldn't move him. No, I couldn't physically move him or bathe him.
Well,
I didn't want him to be in there.
Let me just jump to this part right here. I'm going to dismiss this case Okay? The case isn't going anywhere. I am not going to grant you anything as far as a monetary payment. Only thing I can grant you is advice and say this. The grieving process is something that we all have to go through.
Yeah.
Every last person in this room, we all have to go through that at some point in our lifetime. Okay? How we deal with that grieving process, there is nothing I can say from this bench that is going to comfort you. There's literally nothing I can say to you. I do not know the level of love that you and Richard shared. I would hope that it was a beautiful love. I would hope that it's something that you can grasp onto and think about those good times and those good moments that you had. For 20 years, something good was definitely going on there. And I need you to focus on that love that you guys had between you. Because although Richard isn't here, the love that you had for Richard, that didn't dissipate. You still love him, correct? And I understand, like I said earlier, you want to lay that blame for the grief you're going through right now. But the reality is, no one's at fault for that. Richard passed, and like my grandmother used to say, he's gone to glory.
I just hope nobody else has to suffer the way
Guess
I've
what?
suffered.
I can guarantee that other people are going to die in that facility. I can guarantee that, because that happens. That's what happens in nursing homes. I was a police officer, ma'am. I've been dispatched to a bunch of those facilities. It's a painful thing to go through. I understand that. The city does have counseling services that can help you get through this grief. If you want me to make a recommendation, I can do that. Would you like that, ma'am?
No, I don't need a recommendation.
All right. There's nothing more the court can do for you. And I am sorry for your loss. I am deeply sorry for your loss, ma'am. But like I said, this case is dismissed. I'm sorry.